With the Omicron wave now surging in BC's hospitals, a Victoria woman has a reality check on what she says it means for families when healthcare is pushed to the limit.
Like, it's really jarring to get a phone call at 7:45 in the morning from the hospital saying that they don't have the staff to take care of, a family member. It's a big jolt, yeah.
Helen Bell says she got the call this morning that her 87-year-old mom's nursing team at this hospital, the Royal Jubilee in Victoria, was so short-staffed they needed her here to ensure that her mom is being fed.
So she just called for help. So it's not bad that they call family, but it's just, a sad state that they feel they have to call family in order to have the patient taken care of.
There have been nearly or more than 1,000 people in BC's hospitals with COVID recently. Bell says she's not sure if those outside of hospitals know what this really means for those inside hospitals needing treatment for COVID or, like her mom, for other reasons.
Those are all real people, and the fact that they're being taken care of is really hard for them and their families, but it's also having an impact on people in the hospital for other reasons. And basic things like food and cleanliness are being severely impacted.
She says it's been 3 weeks since there have been enough staff to properly bathe her mom. Not for lack of trying, but she says staff out sick and dealing with record numbers of patients. Her mom's been in hospital for 3 months. And for the last few weeks of Omicron, she says there's been a distinct change.
The healthcare system is under severe stress. And I think it's hard for us when we're out in the general world to realize that, but none of us know when we're going to need the healthcare system, whether for ourselves or for a family member, whether we're going to, break a leg or get hit by a bus.
The Ministry of Health says while they are implementing measures to mitigate staffing challenges, there have been no directives to patient families to assist with feeding due to shortages. They say capacity issues are not impacting the feeding of patients, which is a priority regardless of capacity issues. At last count, mid-January, nearly 18,000 healthcare workers called in sick across BC, nearly twice for the same period in other years. In Victoria, Liza Yuzda, City News.